I would like to discuss oral cancer.
Sure.
And I guess it'll be a really quick discussion because there's probably a lot to this.
Right.
Who is at risk for oral cancer?
Well, when I went to dental school, it was the people who smoke and drank.
That would make sense.
However, that's not the case anymore.
Okay.
Oral cancer can happen to anybody. And that's the really, I'm getting chills in my body already, because oral cancer can be very devastating. However, when you go to a dental office, the dentists are trained to check for oral cancer, and it's the first thing we do. We check all the lymph glands just to make sure there's no swelling. It's the American Cancer Society routine. And then we look inside, and we look down the throat, we look at the sides of the tongue, at the floor of the mouth, and all the tissues of anything
could
suspicious.
It be apparent right off the bat? Could you see something
You
right
could,
away?
You could,
or could
yeah,
not?
absolutely.
Okay.
And then we have a technology called a Valscope, and it is available, and some offices use it. And what it is, it's a blue light, so it shines into those all throughout those tissues, and we can see at a deeper level where the dysplasia or the disruptions are happening in the cells.
If you feel that there's something,
and we can catch things at an earlier stage. Mm-hmm. And so therefore, people don't have to go through the 35 radiations and the 2 or 3 chemos, and it's a tough, tough disease, and nobody ought to be inflicted upon it. But we can find it soon. We can treat, biopsy, get it looked after, and it can be looked after. Mm-hmm. But oral cancer is on the rise. We don't know why, but it is. It's almost as common as cervical cancer for women. So I say if you have pap smears once a year, get oral cancer screened by your dentist or your hygienist. It's very, very important. And even young children, now human papilloma virus is now, HPV is happening in the mouth as well, which is another form of cancer.
Is there a way to prevent it?
No way to prevent it. Just have good hygiene and visit your dentist and make sure, because it's happened to a very close person in my life, and there's no way in a million years that you would ever think that it would ever happen. And it was a small lesion that was watched for 7 years for who knows why, but everyone thought it really wasn't the big deal, and it turned out to be a big deal. So just play safe. Just make sure that your dentist checks, and if you see anything suspicious, have it looked after and follow through.